Thanks for listening. So this screencast is on the education of patients with patellofemoral pain, an area that I'm pretty keen on. And my name is Michael Rathleff. I'm a senior researcher at the research unit for general practice in Aalborg. And this is a part of a series of open access podcasts or screencasts that we record prior to a workshop at La Trobe. So the whole purpose of the podcast is to provide you with all the theoretical details, and then when we meet at La Trobe, we will try to talk more about how do we actually do it, all the practical details. So use these screencasts as a way to get some knowledge before we actually meet at La Trobe, and I hope you will enjoy it. So this screencast will focus on what I think is absolutely the most important part of managing patellofemoral pain. That's the whole education side of things, because it's not all about exercises. Successful management also involves education. And this education that we provide our patients, we need to make sure that it also changes their knowledge and also improve or change behavior. So how to do that. And this is a really, really difficult job, and I don't think we have the solution, but this is some of my ideas on what we need to tell them and how we might be able to tailor it to the individual. So if we return to Anna, 16 years of age, she's just been diagnosed with patellofemoral pain. And the question is, how should we manage her? And if we turn our eyes towards Cochrane, we can see that this recent review, a terrific job, a really thorough review, highlights that we have evidence for the effect of exercise for treating patellofemoral pain. This is a hugely important part of managing patellofemoral pain, exercise. But there's more to it than just exercise. It's not just about figuring out, is it 2 or is it 3 hip exercises, is it knee exercises, should it be in weight bearing or non-weight bearing? There's something that goes along with the exercises, and that's the education. In our randomized trial, where we wanted to study the effect of patient education versus patient education combined with exercise therapy, we kind of struggled in the beginning on what's important for the patients. What kind of information do we need to deliver to them, and how should it be delivered? So we had this discussions a while back in 2011 or 10 when we planned this study. And we decided on to create this educational leaflet. And we based it on local expertise and based it on the way we normally deliver patient education here in Aalborg. And that's through educational leaflets. But the question is that good enough? And can we improve it? Christian Barsen and his colleagues took another step towards figuring out importance of patient education, but also what should be the specific items in the patient education. They did the best practice guide to conservative management of PFP, where they added in or integrated level 1 evidence with expert clinical reasoning. And one of the things that they clearly highlight in their guide is that the education is so important. And they state 4 important things. One is to ensure that patients understand contributing factors to their treatment and condition, advice about activity modification, manage patient expectations regarding rehab, and also to encourage and emphasize the importance of participation in active rehab. So they took it one step further. So instead of basing something on local expertise, they interviewed several international experts on how to deliver and what's the important items to be contained in education side of things. So right around the time where we published our trial, and we also published our education leaflet, here it's shown in Danish, me and Christian started to talk about how can we actually use the information contained in their best practice guide and also build on the leaflet that we used for a previous randomized trial. So what we wanted to do was to make some kind of a generic patient education leaflet that wasn't based on just local expertise, but really reflects what international experts think are important, but also an education leaflet where the patients themselves actually think that the information in it is relevant. What we did was that Christian and me did the first rough draft of a leaflet that was based on the published literature. Then afterwards, we sent this very, very preliminary education leaflet to experts that previously participated in the patellofemoral research retreat. They gave amazing feedback on the accuracy, adequacy, and clarity of the information. Then we revised it and had a couple of pushes back and forth on how the layout and how the information should be contained in the leaflet. After we did that, we then sought feedback from around 20 patients that were diagnosed with patellofemoral pain. We asked them about clarity, the adequacy of information, and we also asked them if the leaflet was enough or they actually feel they needed additional educational resources. So the end product, which is made publicly available, is a short guide. It's 4 pages where you can fold it on the middle. And a funny thing was we spent quite a few hours discussing the title, and we ended up with managing my patellofemoral pain, to really emphasize that it's your patellofemoral pain. You have to take responsibility. We're only providing you the tools, but you have to apply the tools to manage your patellofemoral pain. It contains different sections on why they might have developed patellofemoral pain. The section called What Might Cause My Knee Pain, which is related both a bit about biomechanics, but also about too much, too soon, varied and rapid increases, which might lead to your patellofemoral pain. There's also a section on the different treatment options available. And an important message is this is not meant to be a standalone treatment, something that you can just give your patient, then off you go. This is something you can use as a supplement to normal treatment, something that might improve their retention of knowledge and something that might improve or facilitate them learning how to behave in relation to their patellofemoral pain. And something that I have used previously, which I find quite useful, is that you can print off these different pictograms. So the leaflet might be one standard component that you have and can pull out whenever you deem it's necessary, but also to print out different pictograms that you can use to facilitate education. One of the pictograms that I think are most important are those that relate to the whole concept of training load and activity modification, teaching them how their training load might be part of why they develop patellofemoral pain, giving them tools on how to regress and how to progress their exercise or training load. It might sound simple, but I really find that showing, and it's both adolescents and adults, showing them these simple pictograms really stimulates good communication, and my gut feeling is they understand my main messages much better compared to if they just sit and listen to me talk. And then afterwards, I give them the leaflet where this information is also contained. I think this really helps change behaviors and learning them how to manage their own knee pain. And then when they need to progress, it's not always enough to just show the pictogram and say, this is how you should do it. It's about providing them with some simple tools on how they can progress on their own, how they can take ownership. One of the things we're using at the moment is a really simple activity ladder where they can progress to the next step after they can do a certain step with no pain, or pain from 0 to 2. So they might be able to do walking or bicycling on a VAS 0. Then they're allowed to do fast walking or hard bicycling. They can do that as well. They can do slow running. Well, not really at the moment, because it still causes knee pain above VAS 2. So they might stay at level number 2 for another week, and then they could try again to do some slow running to see if they're within the green zone or the red zone. And that way you learn them how to progress slowly based on their pain response. It's quite simple and it might not be perfect, but you provide them with some tools to learn them how to progress. And if we need to provide them with exercises, we need to provide them with a sound, rational explanation of why do they need to do exercises in order for their knee pain to be better. If we don't do that, I think we're missing out on a huge opportunity to improve compliance, because in all our research and also in clinical practice, compliance is just a major challenge. One of the things that I've done is to, first of all, try to explain why I think these exercises are needed, and then also that exercise compliance is essential. So this is a slide from one of our recent studies where we looked at the dose response, or not the actual dose response, but the association between compliance and effect after 12 months. And what we can see from this graph is that those that did the exercises 3 times per week or more, there were 55% who was actually recovered after 12 months. But among those who only did the exercises less than once per week, only 21% were actually recovered after 12 months. And I use this pictogram or this slide to show them that I want you to do the exercises 3 times per week. If you do them, then there's a higher risk or higher chance of you recovering. But if you decide only to do the exercises once per week or even more rarely, then it actually reduces the odds of your recovery. And you have to know that. And I think it's such an easy way to demonstrate this concept to patients. So hopefully I've convinced you that there's more to managing patellofemoral pain than just exercises. Patient education is it's a vital thing, and I don't think it's easy, but it's something that we need to be aware of, and also all the things that we can integrate into the patient education and the different items that we need to include. And hopefully I've given you some ideas on resources that you can use, like the education leaflet and also the pictograms. I think these slides will be made publicly available, so feel free to print off some of the pictograms that I have used previously, modify them up to you. And at the workshop in La Trobe, there will be a session where we also expand about whole concept of patient education, what items might you include, and how you might tailor the patient education to the individual in front of you. And until we meet, there's a few further questions here that you can use to reflect on. And then again, at the course, this is something that we will have an opportunity to discuss. So thanks for listening, and I look forward to meeting you at La Trobe. Bye.